This year alone, there has been more than 5 outbreaks of diseases in the country. The recent spate of emergencies in the health sector requires accurate data and prompt public health response. That's our focus today on Sound Health. I'm Olasunbo Modupe. Welcome to the show. Thanks for standing by. It's still Sound Health on Lagos Television, and today we are looking at how to achieve a disease-free state. And I have with me Dr. Aisha Usman, a consultant public health physician. She's also the field coordinator with the African Field Epidemiology Network. Welcome to the program.
It's my pleasure to be here.
Okay, looking at the state of health in the country, despite increased funding, outbreak of disease is still on the rise. How did we get here?
Yeah, so we know that the funding for majority of health programs in Nigeria is donor related, and now the donors are reducing their money because they think they have invested so much in Nigeria. So it's for the Nigerian government now to take ownership of the health system. And you are right, we've been having series of outbreaks. Of recent, we had Lassa fever in about 5 states in Nigeria, and about two or 3 days ago now, we've had outbreak of yellow fever is coming up again. So I think it's high time for Nigerian government to take ownership of health system in Nigeria with adequate funding.
We have so many agencies in place. One of them is the Nigerian Center for Disease Control. What then is their role in all of this?
Okay, so the Nigerian Center for Disease Control is modeled against the Center for Disease Prevention in the United States of America, and majorly their role is to, when there is epidemics or outbreak of the disease, to go out and investigate, to know the causes and how they can put preventive control in place.
Okay,
so they have been doing that over time now. Presently, we have people from the NCDC investigating the case of yellow fever outbreak.
Okay.
Now.
If you were to rate public health preparedness ahead of health emergencies on a scale of 5, what would be your scorecard?
Okay, so I will give it 2.5. We are not there yet. Our preparedness for our disasters and outbreak is not where it's supposed to be presently. Although we are improving, it's better than how it was.
Okay, then which areas do you think health officials should focus on before, during, and after disease outbreak?
Okay, so I think the major problem here is funding. Funding is very key. If you look at the national budget, and I think what is budgeted for health is like 2.5%, which is again below the recommendation from the World Health Organization. So major, because we have the manpower, we have trained doctors, nurses, and other healthcare workers in Nigeria. So, but you need funding, you need equipment and other things to work with. So if all these things are in place, I think we are going to move from where we are now, and our health system will be better.
The World Health Assembly has set the year 2020 for the eradication of HIV and AIDS. Do you see Nigeria and Lagos State achieving this status?
We are trying, Nigeria is trying, but presently the Nigerian prevalence, the ANC prevalence for HIV in Nigeria is 3.2%. And for example, the Lagos State that we are now, we have 4%.
2.1.
We have 4%
okay.
From the ANC survey of 2014. The prevalence for Lagos State is 4%. So achieving HIV/AIDS control by 2020, it will be a bit for a country like Nigeria. In my own opinion, I don't think we can read. Although the control strategy and program, they are in place, and we are working to improve this. But 2020 is close, so.
Why did you say it is impossible for us to
I'm not saying
achieve
it is
that?
impossible, but I'm just saying we need to work hard more if we are going to achieve this by 2020.
Okay. Presently, according to a survey that I read, Lagos has a prevalence rate of 2.1. What steps can be taken to achieve a state free of HIV and AIDS?
One of the steps the Lagos State government is taking to achieve the control of HIV/AIDS is this survey that the government is interested in. Is Lagos State AIDS Indicator Survey, and the survey is a population-based survey within the community that will look for the prevalence of HIV/AIDS in Lagos State. That is the number of people that are HIV positive. Okay. And also this survey will let us know how many people are on drugs presently, how many people have viral load suppression. So, and the survey will start by next month. There has been preparatory plan, recruitment, house mapping across the 20 LG in Lagos State. So this is one of the steps that Lagos State government is taking to achieve this.
What is the expected outcomes of the survey?
So at the end of this Lagos State AIDS Indicator Survey, the guys will know the number of people that are living with HIV in Lagos State. We also know the number of people that are recently infected with the disease. And we know this by the age between 0 to 18 months. We know between 10 and 14 years and 15 years and above. And we also know the pattern and behavior relating to HIV/AIDS amongst our youth. And this will help the government in planning for HIV control programs and in even the drugs, number of people that will be placed on ART.
During the survey, are you targeting the physically challenged? Because oftentimes they are relegated to the background. The
scope of this survey is not covering the physically challenged. There are a special survey for them on HIV, and because this survey will involve answering questions and taking blood and getting consent before the field workers can go ahead with it. So we don't want to put anybody in a compromised position. So they are excluded from the survey.
What do you intend to achieve with the survey?
We have recruited able hands, and people will be going out to the enumerated areas, mapped houses in teams. And in a team, we have a 13-man team. We have interviewers, we have counselors, we have field laboratorians, we have a local guide and a tracker who will help people to move around from one enumeration area to another. So when they get to a particular household, they will introduce the survey, the legal survey, to the head of household and explain the mission. When they are allowed into the house, then they will list every member of the household from baby to the eldest person in the household, and they will interview. There's interview section. After the interview, there's blood draw, because we're going to test them for HIV, and after testing them for HIV, we're going to collect blood for further testing in the laboratory. We have satellite laboratories across Lagos State that have been identified for this survey. So we have dispatch riders as part of the team who will take the blood from the field to the satellite laboratories, and so that we maintain cold chain for the blood. And the aim of further testing is to test for the viral load of people, and also incidence testing for HIV.
During the survey, will the results be released instantly to your participants?
So as I've said earlier, people are going to be tested to know their HIV status on the field, but we are not going to give any written results. The result will be verbal. We will just tell you by mouth, and we won't tell it in the presence of any other family members. It's going to be a confidential result. And we have designated health centers offering HIV services in Lagos State, where we will refer people. We give them referral to those hospitals, but in the referral notes, we are not going to write whether the person is positive or negative, because we are conscious of stigmatization. Okay. So we are going to refer them. Once they get there, we have our contact person in each of these facilities who are going to receive them and do the appropriate test for them.
How will the survey help in achieving the Vision 1990 set by the Lagos State government?
This is in line with the Vision 1990, because I've talked about looking at the viral load of people that are HIV positive, and also to know the number of people living with HIV, how many people are on drugs. So this is in line with the Vision 1990 by the United Nations.
Is the survey free, and how will members of the public identify the field workers?
The survey is free. Everything is free. Nobody is paying any money for this survey because it's sponsored by the Lagos State government. So it's a free survey. What we just want from people is just to receive our people when they come. And how do we identify them? One, they will have ID cards that is having the logo of Lagos State government, and we see their Lagos State in AIDS indicator survey. The guys is written on the ID card. Also, we are going to give them letter of introduction. So when they get to a particular household, people should ask for their ID card and this letter coming that they are for Lagos State government and they are working for Lagos State government.
And how long will this survey last?
So the data collection is going to last for 90 days because we have 5,973 households mapped for this survey.
In all the local governments and local councils.
LCDAs in Lagos State. So it's going to be for a period of 90 days. People will be moving from one enumeration areas to another to do this job. And we have about 20 teams that will be working on this project as field workers. It's a very good survey and it's timely for Lagos State because in the past we have been having conflicting data. You know, I quote a prevalence of 4.0, you were quoting 2.1. So these are part of the issue that this survey we address for Lagos State and we give the exact figure so that appropriate planning on HIV/AIDS issue can be addressed.
Okay, thank you. Okay, what are your final thoughts on achieving a successful survey and a state free of HIV and AIDS?
Yes, there should be preventive measures in place in our hospitals, the surveillance and the surveillance. There should be training. Although I know health workers, they have been trained, but there's retraining of health workers to know and identify the signs and symptoms when they see a patient, ability to diagnose those patients correctly. Then also the use of PPE.
What's PPE?
Personal protective equipment when examining the patient is very key. Also, we should have drugs, especially the fluid for rehydration, because these patients, they come out with diarrhea and things like that. So there should be fluid, adequate fluid and other equipment, emergency equipment that should be in place in our healthcare centers.
Okay, thank you so much, Doctor, for sharing your thought with us on achieving an HIV-free state and a successful survey.
Thank you for having me.
That has been Dr. Aisha Usman, a consultant public health physician and the field coordinator with the African Field Epidemiology Network. Sound Health continues with trending and home essentials. Please stay with us. The program continues shortly. Thanks for standing by. It's still Sound Health on Lagos Television, and I'm Olasumbo Modupe. Innovation this week is up next after weekly dose. Please stay with us.
The new art of blood collection and diagnosis.
Blood test results are used to diagnose and treat many diseases, including cardiovascular disease, type 2 diabetes, thyroid disorders, kidney disease, and many cancers. Results from a commercial lab can take from days to weeks. 7 billion lab tests are performed annually in the U.S. 7 to 8 of every 10 clinical decisions made by doctors are based on the results obtained from these blood draws. Blood collection and analysis account for 2 to 2.5% of all health spending today. The method that we have used to retrieve blood samples with a tourniquet applied to a patient's arm and a needle used to take numerous vials of blood for testing is undergoing a dramatic change. Now, hundreds of different tests can be performed from just one drop of a patient's blood. This new blood testing comes at a fraction of the cost of traditional methods with potential to provide results in a matter of hours. There's better information to clinicians. Disease can be caught in its earliest stages, and treatment can begin almost immediately.
This is where we say thank you on today's edition of Sound Health. Hope you've learned a few things about today's topic. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.